In this session, we will discuss technology and its effect on nursing workflow. At the end of this session, you will be able to examine strategies for developing a safety culture, as well as assess how human factors contribute to errors. The healthcare environment has grown more complex and continues to evolve every day. Unfortunately, the complexities that help clinicians to deliver better care and improve patient outcomes also takes a toll on the clinicians themselves. This toll is exemplified through hours spent learning new technology, loss in productivity as the user adjusts and adapts to new technology, and unintended workflow consequences from the use of technology. Despite the perceived negative downstream effects to end users and patients because of technology, this very same technology can improve efficiency and yield a leaner healthcare environment. The goal of this session is to outline the driving forces that create the need to redesign workflow, as well as to explain what the nurse needs to know about how to conduct workflow redesign, measure the impact of workflow changes, and assess the impact of meaningful use. An astounding 98,000 Americans are injured each year as a result of medication errors. Not only is there an impact on patients from these errors, but there is also a significant financial impact to healthcare organizations. The Institute of Medicine report suggests improving care delivery and minimizing error. One of the most important tools to employ is the use of electronic records and information system to provide point-of-care decision support and automation. Workflow is a term used to describe the action or execution of a series of tasks in a prescribed sequence. Another definition of workflow is progression of steps, tasks, events, or interactions that constitute a work process, involves two or more persons, and create or add value to the organization's activities. In a sequential workflow, each step depends on the occurrence of the previous step. In a parallel workflow, two or more steps can occur concurrently. The term workflow is sometimes used interchangeably with the process or process flows, particularly in the context of implementation. Observation and documentation of workflow to better understand what is happening in the current environment and how it can be altered is referred to as process or workflow analysis. A typical output of workflow analysis is a visual depiction of the process, called a process map. The process map ranges from simplistic to fairly complex and provides an excellent tool to identify specific steps. It can also provide a vehicle for communication and a tool upon which to build educational materials as well as policies and procedures. One school of thought suggests that technology should be designed to meet the needs of clinical workflow. This model implies that system analysis have a high degree of control over screen layout and data capture. It also implies that technology is malleable or flexible enough to allow the flexibility to adapt to a variety of workflow scenarios. Lessons learned from more than 3 decades of clinical technology implementation suggest that clinical technologies still have a long way to go on the road to maturity to allow this to be possible. The second and probably most prevalent thought process is that workflows should be adapted to the use of technology. Today, this is by far the most commonly used model given the progress of clinical technology. Not all workflow analysis and redesign occurs prior to the implementation of technology. Some analysis and redesign efforts may occur weeks, months, or even years after following the implementation. When workflow analysis occurs after implementation of the system, this is called optimization. Optimization is the process of moving conditions past their current state and into more efficient and effective methods of performing tasks. Some sources consider optimization to be the act, process, or methodology of making something as a design, system, or decision as perfect, functional, or effective as possible. Some organizations will routinely engage in optimization efforts following implementation, whereas other organizations may undertake this activity in response to a clinician's concerns or a marked change in operational performance. Nursing informatics professionals should always be included in these activities to represent the needs of the clinicians and to serve as a liaison for technological solutions to process problems. Also, informaticists will likely become increasingly operationally focused and will need to transfer their role accordingly to address workflow in an overall capacity as well as respective to technology. If optimization efforts are undertaken, the need to revisit workflow design should not be considered a flaw in the implementation approach. Even a well-designed future state workflow during a technology implementation must be re-examined after its implementation to ensure that what was projected about the future state remains valid and to incorporate any additional workflow elements into the design process. The American Nurses Association in the Nursing Informatics Scope and Standards of Practice defines 9 functional areas of practice for the informatics nurse specialist. The functional areas of analysis identified the specific functional qualities related to workflow analysis. Specifically, the scope and standards indicates that the informatics nurse specialist should develop techniques necessary to assess and improve human-computer interaction. Workflow analysis, however, is not relevant solely to analysis, but rather is part of every functional area the informatics nurse specialist engages in. The functional areas covered by consultant researchers in other areas need to understand workflow and appreciate how lack of efficient workflow affects patient care. A critical aspect of an informatics role is workflow design. Nursing informatics is uniquely positioned to engage in the analysis and redesign processes and tasks surrounding the use of technology. The ANA cites workflow redesign as one of the fundamental skill sets that make up the discipline of this specialty. Workflow analysis should be part of every technology implementation, and the role of the informaticist within this team is to direct others in the execution of this task or to perform this task directly. The workflow redesign team is an interdisciplinary team consisting of process owners. Process owners are those persons who directly engage in the workflow to be analyzed and redesigned. These individuals can speak about the intricacy of the process, include process variations from the norm. When constructing the team, it is important to include individuals who are able to contribute information about the exact current state workflow and offer suggestions for future state improvement. Members of the workflow redesign team should also have the authority to make decisions about how the process should be redesigned. This authority is sometimes issued by managers, or it could come from participation of managers directly. Such a careful blend of decision makers or process owners can be difficult to assemble, but is critical for forming the team and enabling them for success. Often individuals at the manager's level will want to participate exclusively in the redesign process. While having management participate provides the advantage of having the decision makers and management level buy-in, these individuals may also make erroneous assumptions about how the process should be instead of how the process is truly occurring. Conversely, including only process owners who do not possess the authority to make decisions can slow down the work of the team while decisions are made outside of the group sessions. Beyond analysis of tasks, current state mapping provides the opportunity for the process redesign team to distinguish between value-added and non-value-added activity. A value-added activity or step is one that ultimately brings the process closer to completion and changes the product or service for the better. An example of a value-added step would be placing a name tag on a specimen sample. The name tag is necessary for the laboratory personnel to identify the specimen, and therefore its placement is an essential or value-added step in the process. Some steps in a process do not necessarily add value, but are necessary for regulatory or compliance reasons. These steps are still considered necessary and need to be included in the future process. A non-value-added step, in contrast, does not alter the outcome of a process or product. Activities such as handling, moving, or holding are not considered value-added steps and should be evaluated during the workflow analysis. Manipulating papers, moving through computer screens, and walking or transporting items are considered non-value-added activities. Tasks that are considered non-value-added and are not necessary for the purpose of compliance or regulatory reasons should be eliminated from the future state process. The team's purpose in redesigning workflow is to eliminate steps in a process that do not add value to the end state or that create waste by their very nature. A key foundation of the lean philosophy is the removal of waste activities from workflow. Waste is classified as unnecessary activities or an excess of products to perform tasks. The 7 categories of the most widely recognized forms of waste are overproduction, paces faster than necessary to support the process, waiting, transport, inappropriate processing or overprocessing, unnecessary inventory or excess stock, unnecessary motion such as bending, lifting, or moving, and defects or reproduction. The nature of the work situation for the nurse is one of frequent interruptions causing workflow to be disrupted and increasing the chance of error. Variation in workflow is considered the enemy of all good processes and therefore should be eliminated when possible. Variation occurs when workers perform the same function in different ways. It usually occurs because of flaws in the way a process was originally designed due to a disruption or disturbances in the workflow. Examining the process as it exists today will help with identifying variation. A brief statement about variation that cannot be eliminated. Processes that involve highly customized products or services are generally not conducive to standardization, and the elimination of a variation inherent to the process. Some argue that delivery of care is subject to variation owing to its very nature and the individual needs of the patient. There is little doubt that each patient's care should be tailored to meet his or her specific needs. Nevertheless, delivery of care involves some common processes that can be standardized and improved upon without jeopardizing care. Following redesign efforts, regardless of whether they occur during or after implementation or as a standalone process improvement event, steps must be taken to ensure that the change takes hold and the new workflow continues after the support team has disbanded. Management support and involvement during the transition phase is essential, as management will be necessary to enforce new workflow procedures and further define and refine roles and responsibilities. Documentation of the future state workflow should have occurred during the redesign effort, but it is not completely finished until after the redesign is complete and the workflow has become operational. Policies and procedures are addressed and rewritten to encompass the changes in workflows and role assignments. Help desk, system analyst, nursing education, and other support personnel need to be educated about the workflow specifics as part of the post-improvement effort. It is considered good practice to involve the operational staff in the future process discussions and planning to incorporate specifics of these areas and ensure the buy-in from the staff. When workflow changes begin to fail and workarounds develop, they signal that something is flawed about the way in which the new process was constructed and needs to be evaluated further. The workflow redesign team is then brought together to review and, if necessary, redesign the process. The future state is constructed with the best possible knowledge of how the process will ideally work. To move from the current state to the future state, gap analysis is necessary. Gap analysis zeroes in the major areas most affected by the change, namely technology. What often happens in redesign efforts is an exact or near-exact replication of the current state using automation. Gap analysis discussions should generate ideas from the group about how best to utilize the technology to transform practice. Technology implementations alone represent a significant change for clinicians, as does the workflow redesign that accompanies technology. Often the degree of change and its impact is underappreciated and unaccounted for by leadership and staff alike. Engagement of the end user is a critical aspect of change management and therefore adoption. Without end user involvement, change is resisted and efforts are subject to failure. There are many change theories to explore, but regardless of the change theory adopted by the informatics specialist, it is known that communication planning and support are key factors of any change management strategy. Nurse informaticists should become knowledgeable about at least one change theory and use this knowledge as a basis for change management planning as part of every effort. In the Health Information and Management Systems Survey 2009 Nursing Informatics Impact Survey, nursing informaticists were identified as the most significant resources in a project team that influences adoption and change management. Nurses bring to such teams their ability to interact with various clinicians, their knowledge of clinical practice, and their ability to empathize with the clinicians as they experience the impact of workflow change. These innate skills differentiate the nursing informaticists from other members of the implementation team and are highly desirable in the informatics community. Metrics provide an understanding about performance of a process or function. Typically within clinical technology projects, we identify and collect specific metrics about the performance of technology or metrics that capture the level of participation or adoption. Equally important is the need for process performance metrics. Process metrics are collected at the initial stage of the project in problem identification. Current state metrics are then benchmarked against an external source, such as a similar business practice within a different industry. An example of this is a hotel room changeover strategy or the customer service approach of Walt Disney Company or Ritz-Carlton Hotels to determine suitable metrics for a particular project or focus area. Although workflow analysis principles are described within the context of acute and ambulatory care, the need to perform process analysis on a macro or larger level will expand as more organizations move forward with the health information exchange and medical home models. Health information exchange require the nursing informaticists to visualize how patients move through the entire continuum of care and not just a select patient care area. Technology initiatives will become increasingly complex, and therefore nursing informaticists will need greater preparation in the area of process analysis and improvement techniques to meet the growing challenges technology brings and operational performance demands of fiscally impaired healthcare organizations. Workflow redesign is a critical aspect of technology implementation, and when done well, yields technology that is more likely to achieve the intended patient outcomes and the safety benefit. Nursing informatics professionals are taking on a greater role with respect to workflow design, and this aspect of practice will grow in light of meaningful use-driven objectives. Other initiatives that affect hospital performance will also drive informatics professionals to influence how technology is used in the context of workflow to improve upon the bottom line.